name is Brian Mugambi. I'm a psychologist at PCEA Chogoria Hospital, and this month being Mental Health Awareness Month, I would like us to talk about psychosis. And generally, psychosis is a mental illness that is characterized by disconnect from reality. It comes up with symptoms such as hallucinations, for example, visual hallucinations, auditory hallucinations, tactile hallucinations, and gustatory hallucinations, olfactory hallucinations, delusions, and also disorganized thinking, and also positive symptoms, mostly symptoms which actually are in disorders such as mood disorders, such as depression. And when we talk about the disorder, I'd like us to know what actually causes the disorder. Mostly it comes from other disorders such as schizophrenia, such as bipolar disorder, and also substance use can also come from substance use like as alcohol use disorder, or also marijuana use and other drugs and substances. So treatment services here at Chogoria Hospital, we offer a wide range of treatment services, and we also do services like psychotherapy services if there are no severe cases. We also use pharmacotherapy, and we use treatment like medication treatment like antipsychotic medications so as to treat some of these disorders. Psychosis is a mental illness that affects a wide range of human beings. It can affect small kids, it can also affect teenagers and also old people. And when you're talking about it, it comes with a certain variety of symptoms. We're talking about hallucinations. It can also come in form of delusions or the false beliefs that bad things are actually happening to you. For example, in the case of persecutory delusions, it can also have paranoid delusions, can also have nihilistic delusions. It also comes with other symptoms of negative symptoms, or positive symptoms rather. We're talking about anhedonia. It also comes with symptoms such as disorganized thinking. Well, treatment services in this hospital, we offer psychotherapy services for cases which are actually manageable, and for severe cases, we like to entail also medications whereby we use antipsychotics to treat them. And also for further or those extreme cases, we kind of like refer them to psychiatric units around the region. Okay, when we talk about psychosis, I'd like us to further broaden this topic on psychosis and how we get back to schizophrenia and how they're related. So when we talk about it, it starts as brief psychotic disorder, which actually lasts for between 1 and 3 months. And then there's also schizophrenic disorder, which now follows, which now lasts in between 3 to 6 months. And now further, we talk about schizophrenia now, which further now it's psychosis, which lasts now for 6 months and above 6 months, that is. And when we talk about this schizophrenia, it's a wide spectrum. It comprises of certain symptoms, as I have talked earlier. We're talking about hallucinations. We've listed all the 5 hallucinations, or the 5 sensory hallucinations, which are actually visual hallucinations, olfactory hallucinations, gustatory, auditory, and olfactory hallucinations. We're also talking about delusions, which is actually, for example, you're talking about delusions of grandiose, delusions of paranoia, or the paranoid delusions, so delusions of nihilistic delusions. We also talk about positive symptoms, like for example, symptoms that we experience mostly in other disorders like depression, and anhedonia is one of the symptoms. And sometimes one can also have bizarre behaviors, which is actually one of the symptoms also, crucial to understanding what schizophrenia is. And some of these bizarre behaviors which are actually odd, and in most cases can come, like for example, catatonic behaviors. Catatonic schizophrenia is one of the differentiations or distinguishable branches of this psychosis. Are you experiencing these symptoms of schizophrenia, or do you have somebody who is experiencing these symptoms? So kindly, we urge you to visit our clinic, which is actually open from Mondays to Fridays here at PCEA Chogoria Hospital for further services. We do care with love, and your mental health matters.